Hello everyone, wish you all a very happy International Women's Day. On this Women's Day, let's talk about cervical cancer, which is one of the leading cancer in women. Let me first tell you what is cervical cancer. Cervix is something called the mouth of the uterus. That is, if this is the uterus, the lower part of the uterus is called cervix. This is what usually opens during birthing and it forms like a birth canal. Now, what is cervical cancer? Cancer happening in that mouth of the uterus is called cervical cancer. About 1.3 lakhs women in India develop a cervical cancer every year, and 1/3 of them pass early. So, it is very important for us to know what is cervical cancer, how to prevent it, and what are the reasons about. First, let me talk to you about what are the risk factors for cervical cancer. Most cervical cancers are caused by a virus called human papilloma virus or HPV infection. And there are other reasons, but HPV prevention is the single most preventive factor for preventing cervical cancer. So how can you acquire HPV? Most common way of acquiring HPV is sexual activity. Unprotected intercourse, multiple sexual partners, smoking, other sexually transmitted diseases like chlamydia and HIV, and poor hygiene are some contributory factors to HPV infection and cervical cancer. What could be the symptoms of cervical cancer? Most common symptoms are altered vaginal discharge. A normal vaginal discharge is usually white or very rarely very slightly yellow with no smell, no reddish tinge to it, no greenish tinge to it. And there's no foul smell in a normal discharge. But in cervical cancer, one may present with a reddish or brown discharge or excessive watery discharge from the vagina. Or discharge after intercourse is also very common in cervical cancer, but most women do not present until late. So, there comes early screening for cervical cancer. This is one cancer which has a latency period. Latency period means from the time you are about to develop to the time actually it develops is pretty long. It's about 10 to 20 years. So, you have to try and pick it up early. How? There is something called pap smear, which is a very simple office test where it doesn't involve pain, it is only very mild discomfort, which can be done every 3 years from the age of 21 to 65 in women, every 3 years at least, along with HPV virus screening. This picks up early stages of cancer or even pre-cancer, and hence treating those can cause prevention of cervical cancer. How do you prevent cervical cancer? There is a beautiful vaccine called HPV vaccine, human papilloma virus vaccine, which can be taken by all women between the age of 9 to 45. Now, it comes as a 2-dose vaccine for kids between 9 to 15, and women between 15 to 45, it's a 3-dose vaccine, which prevents most of cervical cancer. So, I urge all women to think about getting themselves vaccinated for cervical cancer. Thank you.